Staff. Hiring and maintaining staff. The RN qualifications, they have to be licensed, have a current license with the Alabama State Board of Nursing to practice nursing. We prefer that they have at least 2 years experience as a registered nurse in public health, hospital, or long-term care, but it is not required. They must be capable of evaluating the personal care worker in terms of their ability to carry out assigned duties and their ability to relate to the participant. They must be able to assume responsibility for in-service training for personal care workers by individual instruction, group meetings, virtual meetings, or workshops. They must pass a statewide background check and have current verification of an initial TB skin test. It must be in their personnel file in addition to annual screenings and subsequent tests if warranted. The LPN qualifications are essentially the same. They must be currently licensed by Alabama State Board of Nursing. They must pass a statewide and local background check. We prefer, but it is not required, that they have at least 2 years experience as an LPN in public health, hospital, or long-term care. They must be capable of evaluating the personal care worker in terms of their ability to carry out assigned duties and ability to relate to clients. They must have the ability to assume responsibility for in-service training for personal care workers by individual instruction, group meetings, virtual meetings, or workshops. And they must have verification that they have had an initial TB skin test and annual screenings, and if needed, subsequent tests, and that must be in their personnel file. Personal care respite care worker qualifications. They must have 3 references that will be verified thoroughly and documented. They must be able to read and write, have completed at least an 8th grade education, are able to follow plan of care with minimal supervision, are able to perform the essential functions of the job. They are employed by you prior to the provision of services. So if they haven't completed the hiring process, you cannot send them out to provide services to a client. They are free from communicable diseases as demonstrated with a negative TB test, in addition to annual screenings and subsequent tests if warranted. They have no physical or mental impairment to prevent lifting, transferring, or providing any other assistance to the client. They demonstrate emotional maturity and proper attitude toward the participants, their families, and the general public. They have the ability to establish and to maintain effective working relationships with the participant and family. They have verification of statewide criminal background check, a national sex offender register check, and nurse aid register check. They must be able to pass the local, state, and national verifications. Personal assistant qualifications. They must meet the personal care worker qualifications and must be able to assist the participant appropriately with daily activities related to personal care in an employment setting. Excuse me. They must be at least 21 years of age. They have to have a valid driver's license and proof of current vehicle insurance. Excuse me. They have to have at least a 10th grade education, preferably be a high school graduate or have a GED. They must be free from communicable diseases as demonstrated with a negative TB test in their personnel file, in addition to annual screenings and subsequent tests if warranted. Can family members be personal care workers, respite care workers, or personal assistant services workers? Sir, this is important. Services provided by friends or family members must be approved in writing by the sale director prior to employment and provision of services. The original written approval must be kept in the employee's personnel file. Services provided by friends and family members may be approved only if the relative or friend meets the same qualifications as any other worker. There are strict controls to ensure that payment is made to the relative or friends as provided only in return for personal care services. There is adequate justification for the relative or friend as the provider of care, and proof is provided to show lack of other qualified providers in the area. Under no circumstances will payment be made for services furnished to an adult disabled child by the parent, to a parent by their child, to a participant's spouse, or to a minor by a parent or step-parent. Pre-hire responsibilities of the DSP, and this is straight from the Medicaid manual. Statewide background checks will be required for all service employees and for any employee who operates within the state of Alabama and has access to client records, which is probably everyone in your office. Branch office employees, including non-visiting employees employed by the DSP and who have access to client records, are required to undergo background checks. Out-of-state corporate office employees will not be required to have a background check. It bears repeating. Probably everyone in your office has access to client records. So they will have to have a statewide background check. Corporate employees, out-of-state corporate employees will not be required to have a background check. Pre-hire checklist. This is just our form that you can feel free to copy. You have probably all have your own checklist, but to make sure that everything has happened before you send somebody out to apply. Name, date of hire is important. When the background checks are completed, when the TB test was administered and when it was read, when the training was completed, and company identification. Everyone who goes into a home is required to have a company ID in the first date of client contract. Verifications, a criminal background check includes both local and state background checks. Other states as needed. Use common sense. If somebody lives in Phoenix City and has been working in Columbus, Georgia, then they need to have a Georgia background check as well. Check National Sex Offender Registry. Make sure all the states have been checked. Sometimes those reports get run and you get them back and they say that, you know, Mississippi was down. So you have to keep running it until Mississippi is up and you have gotten all the states. Check the nurse aid registry. Check the Alabama Board of Nursing for RNs and LPNs. And you have to check the debarment initially and monthly. Every month you need to check the debarments to make sure everybody is still eligible to work. Background checks. The statewide background check shall include the following personal identifiers: a name, social security number, date of birth, the driver's license number, and or state issued non-driver's ID. The background check must include the National Sex Offender Public Registry. Again, make sure all those states have been checked. The background check documentation must not be altered in any manner, including print or run dates. Documentation that cannot be verified will be considered invalid. You cannot handwrite the run dates on these background checks. If the run date didn't print out, it means you didn't print out the correct screen, and you'll need to go ahead and do that correctly to go into the personnel file. Permanently disqualifying convictions or pending charges, any crime of violence, whether it's a misdemeanor or a felony. Any felony convictions, as well as any pending felony arrests. The following criminal convictions that would prevent an individual from being employed for the time period as specified below. Reckless endangerment in the last 5 years. Stalking in the second degree in the past 5 years. Criminal trespass in the first degree in the past 5 years. Violating a protective order in the past 3 years. Unlawful contact in the first degree in the past 3 years. Criminal mischief in the first degree in the past 7 years. Unlawful contact in the second degree in the past year. The operating agency will have the final discretion on the application of the above guidance and may implement a more restrictive policy in relation to the performance of statewide background checks for it. Debarments. You are required to check debarments monthly for staff who work in clients' homes. Any provider participating or applying to participate in the Medicaid program must search Medicaid's exclusion list or list of excluded individuals and entities. The Office of the Inspector General maintains a national list of all individuals who are excluded from receiving reimbursement from Medicare and Medicaid. For a comprehensive list of all individuals, go to oig.hhs.gov/fraud/exclusions.asp. Also, any provider participating or applying to participate in the Medicaid program must search all 3 lists prior to hiring staff to ensure that no potential employees or contractors have been excluded from participating in the Medicaid program. For further details on screening of current and potential employees and contractors, see the Medicaid Provider Manual on the Alabama Medicaid website. Staff training requirements. So you've hired somebody, you've checked their references, they've passed the background check, and now you have to train them before you can send them into somebody's home. You're responsible for providing annual in-service training. The minimum training requirement, 12 hours on core topics, must be successfully completed prior to working with the client. You must provide a minimum of 12 additional hours of relevant in-service training per calendar year. And when we talk about relevant training, with us, we do not serve children, so any training regarding pediatric care would not be relevant for the sale waiver. You must document and maintain all records of workers' initial and yearly training in addition to workers' annual performance appraisals. Hard copy personnel files must be kept on each worker, documenting that each worker has met the above requirements. Proof of training must be recorded in the worker's personnel file. You must also submit your annual in-service training plans because they must be pre-approved by SAIL. Physical initial training topics. Physical, emotional, and developmental needs of individuals with severe disabilities, as well as ways to work with the population served, including the need for respect of clients, their privacy, and their property. Activities of daily living, including a sponge bathing, sponge and tub bathing, personal grooming, personal hygiene, meal planning and preparation, and transfers using proper lifting techniques. Assistance with ambulation using proper lifting techniques. Home support, for example, light cleaning, light laundry, home safety. Medication, and you know that's handing somebody medication to take as a reminder. Tuberculosis control, basic infection control, communication skills, record keeping, for example, the EVV, that's the electronic visit verification system, log in and log out to record time worked and to document specific personal care services provided to client. Monitoring the client, for example, observing for signs of changed condition, prompting client to take medication as directed, recognizing basic medical problems and medical emergencies, and performing basic first aid for emergencies. Maintaining worker files. The DSP will maintain a hard copy file of each employee who provides or reviews services. The file will include application with work history, basic education, copy of diplomas for supervisory staff, valid government issued picture IDs, in other words, a driver's license or a non-driver's ID, professional license verification, verify personal and work references, a job description, I-9 documentation, background check verification, sex offender verification, debarment verification pre-hire, date of hire, confidentiality and other contractual agreements, copy of company picture ID, orientation and training prior to service delivery, ongoing in-service training documentation, supervisory visits, a minimum of every 6 months, performance evaluations, those are annual, TB test results pre-service, and an annual TB screening and subsequent test if warranted, debarment verification monthly, and complaints and resolutions. And the complaints and resolutions, we'll talk about this later also, but it's kept in 3 places: in the employee file, in the client file, and in the complaint log.